Initial consult is really an opportunity for us to understand everything that's been going on with that individual, not necessarily about that specific pathology or injury that they might be presenting with, but really trying to tie all of the pieces in together. Normally, injuries are not kind of siloed. And so we try to figure out kind of the whole comprehensive what's been happening even since you were, 15, 20 years ago or 3 months ago or things like that. So it starts off with the subjective evaluation or in kind of the patient talking to us about how they've been presenting, their past medical history, whether that be orthopedic, general medical, psychological, she'll kind of all trying to take that the whole person into account. And then we get into any sort of review of diagnostic imaging, if that has been done, x-rays, MRIs, CTs, ultrasound, things like that. Then we get into kind of the palpation and me looking at the segment and the functional lines that might be associated with that injury or pathology. Then we get into kind of special tests and trying to figure out, is there a specific pathology that we can test and try to see, could this be it, and try to create this list of like what might be the differential diagnoses. And then we get into our functional assessment where we have the patient move and go through either range of motion or movement patterns, like our hip hinge, rotational from the trunk, rotational from the hips, squat techniques, single leg balance, things like that. And that can kind of feed us into a little bit better of what might be happening on the day to day. We also try to replicate motions that might be most provocative or symptomatic for people, because that might look different than based off of what our traditional kind of testing and functional tests might be. From there, we try to bring everything together. We do a lot of patient education, a lot of, demonstrating and showing pictures and videos for people so that we're all kind of on the same page. It's a great opportunity for people to ask questions and just make sure that they understand what might be going on a little bit better. And then we kind of game plan from there. We talk a lot about what the patient goals are, for either that session or sessions moving forward, how we can incorporate that into daily lifestyles, either workout programs or rehab programs or just maybe pain management. And then from there, we talk a lot about what the next steps are going to be. So whether that be, coming in here or, adding in whatever they need to in kind of their activities of daily living or, PT settings or and anything like that. And so it's really just an opportunity for patients, I think, to be a little bit more comfortable about what's going on and feel more educated about that.